good morning, everybody. This is Carrie Scroggins, and introducing my husband this morning, Bill Scroggins. He is recovering from a very complicated, delicate neck surgery, and he is wanting to put some information out here. So if you are contemplating this surgery, you have some more specific information. So let's just say hi, Bill.
Good morning, all. How's I hope everybody's doing well.
Okay, so let's talk about the type of surgery that you had. You had on December the 6th what is called a discectomy infusion. So for the viewers, that is removing 4 of your discs in your neck.
That is correct.
And then replacing those discs with a fabricated, what's called a cage, that's inserted in between your vertebrae, and then a fusion, meaning that the vertebrae was then connected with a plate and some screws. And a rod. And they went through the front of your neck, and they went through your
traps.
The traps on your shoulder. So can you show us where they went through the front of your neck? Just kind of point to it.
The front of the neck is kind of right here. It's probably hard to see.
Okay.
They had a drain tube in right here. It was in for about 5 days.
Okay.
Afterwards, so. And then they have 2 incisions.
Let me talk so you don't run out of breath.
There's 2 incisions on the back where they put the rod in my neck to fuse the neck bone back there. There's 2 infusions on the left and right of my neck.
Okay, so you have about a 2.5-inch scar on the front of your neck and 2-inch scars on the back of your neck on top of your shoulders.
That is correct.
Okay, so just to help him along, because he's still getting winded, I'm just going to kind of help him answer some of these questions for you guys. So this surgery took place on the 6th of December. It was a 6.5-hour surgery, and he spent 3 nights in the hospital. Do you remember waking up?
No.
When would you say you had the first recollection after surgery? How many days after your surgery would you say? Were you still in the hospital?
Yes, I was in the hospital for Wednesday, Thursday, and we came home Friday. So the first recollection I have of anything was probably Thursday around lunchtime.
Okay.
When the lady came in and was trying to get me out of bed.
Okay. Okay, so when you woke up from surgery, you had a drain in your neck, correct?
That is correct.
Okay. And could you swallow when you woke up from surgery?
I couldn't swallow at all, hardly.
Okay, and the reason for that, so you know, viewers, is when you have this surgery and they go through the front, they have to move all of the structures in your neck. So they have to move your esophagus over, they've got to move your windpipe, they've got to move your jugular veins, they got to move the muscles and the nerves, and they have to move all that out of the way. So when they do that, you get a lot of swelling and a lot of injury in order to get to the vertebrae. So that's one of the reasons when you wake up from this surgery, you're going to have a hard time swallowing. So you're just about a month and 4 days now in recovery. Do you still struggle with your swallowing?
Yes, I still struggle with swallowing.
Okay. And do you feel like you've got to really, really chew your food in small, small bites? And are you eating everything again, or are you still sort of on soups and stews and that type of thing?
Well, I would probably say yes to all of that. I definitely have to chew my food up really, really fine to get it swallowed down.
Okay.
I have found since the surgery was on this side of my neck, if I tilt my neck or head just a little bit to the right, I can swallow a little bit easier.
Okay.
But I still have to chew the food up very, very good to get it down. As far as the consistency of food, I'm pretty much back to eating what I want to eat to a degree. We are still staying on the more or less the soup and stew side.
Is that because it's easier for you?
It's easier for me to swallow.
Okay.
And eat and chew that. I love steak, so the wife does beef tips, and we stew those all day long, so it is really, really tender.
Okay.
So, and we add rice with it, so rice gets real soft. I can swallow it, and so forth.
Okay.
Well, those are the things that the stuff that they give you in the hospital is so bland. You'll get a real good appreciation for what food really tastes like after the surgery.
Okay. What would you say surprised you the most right after surgery? What's the one thing that you were surprised with or didn't expect right after surgery?
Well, I guess the bounce back. I was anticipating probably a week, maybe 2 weeks of bounce back. Doesn't happen. I think after the first week or that Monday after I came home and we got physical therapy started, which is a must. He came in and showed me some exercises to start helping to strengthen me, because with this surgery, anticipate on losing about 30 pounds. I went from 215 to 185 in 3 days.
Well, it wasn't 3 days. It was about a week and a half all total. It seemed like 3 days to you because you were recovering from surgery.
Yeah, from the day that, maybe it was 5, from the day the surgery was the 6th, and I probably didn't get on the scales till probably the 10th.
Yeah.
And that's when I noticed the biggest difference was the weight loss.
Okay, so you had this surgery because you were having trouble with your walking, your balance, your gait. You had some speech problems, and to make this easier so you don't get out of breath, that's why I'm injecting here. So your spinal column was pressed. The vertebrae actually pressed your spinal or compressed your spinal column. So the spinal column wasn't firing correctly at 2, 3, 3, 4, 4, 5, and 5, 6. So there's 4 discs there that were actually squeezing and preventing your spinal column from shooting the nerve conduction to the right area. So you had this surgery to alleviate that compression, which hopefully at some point you will get a complete recovery of those nerves.
Yes.
Now, since your surgery, we've been told the average person, when they have a compressed spinal column, for each day that your spinal column is compressed, it takes 7 to 8 days to recover that nerve conduction. So in your case, you've had these symptoms for over 3 years.
That is correct.
Is that correct? So if you do the math on that, your recovery is going to be complete recovery, which is what we both are hoping for, will be down the road. This is not a sprint. This is a long journey of recovery. Would you agree with that?
I would agree with that.
Was that what you were
tortoise and a rabbit?
Right.
And here's the tortoise.
So would you say you expected that or didn't expect that?
I didn't expect that, and I wasn't told. I don't feel like I was told that or was instructed with this. This is just things that we have learned from the physical therapist, and asking questions, them asking how I'm doing, and they indulge us in information. How correct it is, but you have to take it with a grain of salt.
Okay, so sitting here a month later now, have you already seen improvement?
I would say yes. I have an app on my phone for my walking. I'm one of those persons that I don't like laying in bed. It's hard to sit up in bed in general and just sit there and do nothing all day. So I installed a walking app, counts my steps, and converts those steps into miles.
Okay.
So
that's what you expected that, but did you expect that your recovery was going to be as lengthy a recovery?
No.
Okay.
I've been at 4 weeks now. I'm just now probably getting back to where I feel more comfortable and ease on my feet.
Okay, very good.
My left leg definitely seems to be, when you walk, you kind of kick from your knee out when you walk, and I was dragging my left knee.
What would you say is the one thing that has impressed you the most in your recovery, or the one thing that you have learned in recovery that you didn't have prior to the recovery?
The other symptoms that probably come along with that, that maybe I wasn't aware of, but
Okay.
as far as the best thing that I can say right now is my walking.
Okay.
I see a big difference in how my left leg works compared to what it used to work or didn't work, let's put it that way.
And what's been the hardest part of your recovery to date?
Sitting in a chair doing nothing.
Okay. I noticed
that is the hardest part.
Okay, I noticed that as you can see, we're filming, but we're not filming where you normally sit. We decided in the hospital, because our son's a paramedic, to buy you a recliner so you could sit up and get out of bed and change your position. Would you say that that's a really important buy for anybody that's having this surgery?
I would say yes.
Okay.
Like I said, like the wife said, I'm not a bed person, and I hate laying on my back. I'm a side sleeper, so by getting this chair, it made the world of difference.
Okay, and the chair does massage.
It does massage,
and it reclines. Heat. Oh, and it has heat. That's right.
And I thought it was a pretty good deal when we got it.
I believe we paid $250 for it, and I think anybody that's watching this video, that is definitely a pre-surgery purchase.
Yes.
We were lucky enough to find it and get it to the house the day after you came home. But if you're watching this surgery and you're having this type of neck fusion surgery, I can just tell you from my perspective, watching you recover, I think your recovery would have been much more difficult if you had not had this recliner. So do you agree with that statement that everybody should spend the money on a recliner so you have a better chance to recover?
I would agree with that.
Okay.
There's two reasons why. The therapy wants you to get up, moving around. So moving from the bed to the recliner with the walker, which is a must as well. I'm still using the walker today to help strengthen my muscles so I can get away from the walker. But just to get you to walk from my bedroom to the recliner is helping. So,
okay, and today you are, I think it's important to let everybody know that when you come home, it's important to have home health nursing. You had nursing for 2 full weeks, and you are in your 5th week of recovery, and you still have physical therapy in the house, you still have occupational therapy in the house, and you still have home health coming out to do assessments once a week. Would you say that you expected that, and do you think that that's been beneficial to your recovery?
I didn't expect that, but I'm glad we went ahead and used them. To try to go this alone without that extra support, showing you techniques to help strengthen things and how to get in and out of bed. You know, we had to make some modifications as far as moving and removing the door so the walker would go through. Just little bitty tips that they gave us that I would have never thought of before.
And do you think that it would have been much more difficult if you had to go somewhere every day to occupational therapy and physical therapy? Actually get in the car, get out of the car, go,
Yes.
all of that.
Yes, I would think that would be a lot harder. On Christmas Day, to give you a little insight, Christmas Day, I was probably about 2 weeks into recovery, and I had the tube taken out, and they told me that I should try to get back to as much activity as possible. So we took a ride to my son's house, about 40 miles one way. And the road trip and the beating of the road, and we have a nice car, so we got good shocks on it. It still took a lot out of me. I mean, I got there, I felt pretty good. On the way home, I had to take a pain pill.
So how talking about that? So when you do something like that, how many days does it take you to bounce back? So you were gone all day. It was an 8-hour day, sitting up, being with everybody, not taking a nap, not resting. So it was a full day for only your second time out of the house. How long do you feel it took you to rebound from that full day of activity?
Probably about 3 or 4 days.
4 days.
The other key thing is they tell you to rest. So I have gotten in a routine where I try to take a nap once a day. Just in the afternoon after lunch, usually I'll take a pain pill just to help me relax. So we got we got a pain pill with oxycodone in it, and we have a muscle relaxer. So the muscle relaxer was for the traps to relax because that's where I had my most pain. And of course, I'm wearing a stimulator that they wanted me to.
Yeah, we'll talk about that in a second.
Okay, that they wanted me to wear as well. So,
what do you think? What do you wish you knew more about before your surgery? Do you feel like you weren't informed well enough about any of the recovery, the surgery? How do you feel like your knowledge level was before and after surgery?
When we met with the doctor the first time, he did tell us that it would be a slow recovery. You kind of just shrug that off as a whole because you think you know your body in general, I think. So the biggest thing was they told us this would be a long haul. As a person that, I've had surgery before, I've had this type of surgery, I've had my left leg worked on, my knees worked on, and I bounced back pretty quick. I was thinking the same. I had that mental thought that I'll just jump back in 2 weeks, I'll be doing my stuff again. Not the case.
So that's the one thing you would say that you really thought was going to be, and then it wasn't. So that's been a hard transition for you to get your head around that.
To get my head around it, just be aware of guys that, or any guys or girls that are women that are going through this procedure. It is a long process. You're not just going to jump back into things. You're going to have to gradually work yourself up to it like a marathon. Like one of the therapists says, how do you run a marathon? You don't just go out and run a 5K one day. You gradually run maybe a quarter mile. Then you extend that quarter mile to a half a mile, and then so forth until you get up to that 5K distance that you know you can compare and work yourself up to that. That's what this is.
Okay. So this is a marathon. This is not a sprint, and you've got to go into it knowing that it's a marathon. I want to talk to the viewers a little bit about preparing for surgery. I know that you and I have been really frustrated this week. I'm an insurance agent, so we knew that you were going to be going on short-term disability. Do you think that we were prepared enough prior to surgery and had everything taken care of, having all of our ducks in a row with your benefits and with your short-term disability? I think this is a really big part of the surgery that nobody talks to you about. And if you're still working, it is definitely something that you've got to be prepared for. Do you think anybody gave us direction on that?
I don't. We've had to find all of the stuff out pretty much by being frustrated to a point of no end, basically. When I talk about that, it just makes me frustrated. I had the insurance in place. We were told we had short-term and long-term disability we could apply for. Nobody ever told us
the elimination
criteria.
Right, the elimination period. So,
with that said, just double check into it really, really hard. My plan in general had a 7-day grace period.
Waiting period.
a waiting grace period.
It's not a grace period. It's called a waiting period or an elimination period. So the viewers know that means that for 7 days you have no benefits from your disability company, and that's an important piece that we weren't told.
That's my system.
Right.
You need to check your own system.
Right. Most disability policies do have what's called an elimination or waiting period. We were not told that. So even as an insurance agent, you know, I know how it all works, but I think the point here is for our viewers that if you are working, you definitely need to sit down with your HR department and ask all of the questions, have them walk you through step by step what's going to happen with your benefits and with your PTO or your paid time off. Do you feel like we weren't completely informed or prepared, and we've had to find that out on the backside?
I do feel that way. I think we have it squared away now, but we're a month into my recovery.
Right.
And we're just now finding out more stuff that we will probably have to reapply for that, because I guess somebody has to do something on their back end to do that. So you have to reapply every 30 days, even after you're approved for your first round. So they approved, in my case, they approved the disability on the 20th, which was well after the surgery.
Right.
But they had backdated it to the 13th, which was the 7-day grace period for us.
I think we just
surgery on the 6th. So, but you know, it's going to be different for everybody. So you just really need to check.
Right. I think that's the thing is we're just trying to get across to you guys that it's so important to really get all the questions answered and ask as many questions as you can, because we feel like there was a big piece of the puzzle that wasn't explained to us, and we sort of had to find it out on the backside. That's the whole purpose of us doing a video here, because when you have this kind of surgery and you are not working, obviously that's going to affect your finances, right? So you need to know all of that ahead of time so you can plan for it. We felt like we were really prepared, but in actual fact, we didn't have all the information, correct? So we couldn't be 100% prepared because we didn't have all the information prior to the actual surgery date. And I think that's what the viewers need to know is on the financial side of this process, you really have to know what your benefits are going to pay, how they're going to pay, when they're going to pay, and if there is any time that they're not going to pay, because it can screw up your finances. Would you agree with that?
Oh, I know that. It is, you know, everybody has finances and responsibilities. In this day and age today, in this COVID world, you know, most of your collectors, your water bill, your power bill, whatever, your house note, whatever bill it may be, they give you a extension or a grace period to pay that bill. They don't do that anymore. If you hadn't made that bill on the due date, they start charging you late fees. Most people probably realize that now by now, but I probably shouldn't be talking about it, but I'm going to talk about it anyway. Those late bills and those fees start adding up really, really fast.
Yeah, that's why
even though it's $15 or $20, start doing the math when you hadn't made that bill, and then your utilities get cut off.
Yeah.
You know, so you have to be aware of all of that stuff.
That's just a really big part of this surgery is the financial side of it and making sure that you've got every single duck in a row, because you don't want, and it hasn't for you, I don't feel like, but I think it could have very much stressed you out and made your recovery even harder, worrying about all of those things. And would you agree that that potentially could have been a problem? You haven't really experienced it, but it could have been a problem.
Yeah, it could be a problem. There is no doubt. We haven't experienced it to a degree, but we have experienced it to a degree with a couple of people.
Right.
I thought I had done stuff on one of my bills, try to put it in there like a forbearance, knowing that I was going to have this surgery. I couldn't get anybody on the phone, so I sent them an email. Mm-hmm. They didn't acknowledge after the fact that they had gotten the email but didn't respond to me.
Right.
So I was in the assumption that we were good to go.
Right.
And
so I think the point is just be really prepared, right? So you as the patient don't have to worry about anything except your recovery. Right. So let's talk a little bit about how you feel about the pain medications. Were you nervous about the pain medication? Do you still at 5 weeks, do you still need the pain medication? Are you comfortable with it, and have you had any side effects from it?
I don't think I've had any side effects from it. I've never been a pain person myself. I think I've got a high tolerance for pain, so I didn't take pain meds, and I don't take things for pain. But when we first got home, we were on a regimen because the pain was never no pain in the front of the neck. It was all in the back where they cut through my traps.
So that regimen or that schedule, did that help you?
That, if you can stay on a regimented schedule, you know, and we were alternating from muscle relaxers to pain pills. Mm-hmm. So we were probably about the first 2.5, 3 weeks, we were on a schedule. We take it no matter if we had pain or not pain. In my case, I had pain. I said, like right now, I have pain in my neck, in my left trap, where they cut the most, I think. It's just a nagging pain, like someone pressure point pain.
Okay. But do you still think at week 5 that you are getting beneficial relief from your pain medication, and does it still worry you to be taking it at week 5?
Well, I don't take the pain medication except when I go to bed now, and I don't take a full pill. I usually take a half a pill just to try to knock me out and relieve the pain so I can sleep.
Okay.
Like I mentioned earlier, I've never been a back sleeper. If you're not a back sleeper, or if you are a back sleeper, you probably do very well with this surgery. If you're not a back sleeper, as I'm not, I'm a side sleeper, you have to find that spot where you can lay with your back and your neck vertical.
So you definitely had to learn. You've had to learn a different position and method of sleeping because of this surgery.
Yeah. My surgeon did not want to put me in a halo. So he said that would have been even harder to sleep in. So he opted not to put me in a halo. He opted to give me the stimulator. So you have to find a way to sleep. And that's what the therapists and occupational therapists, people will help you do and find. I did find out that I was using, the occupational therapist felt I was using too many pillows, but I was trying to sit up and lay on my back and support my neck.
So that's been beneficial. The occupational therapy has been really beneficial.
By telling me to remove at least one of the pillows and kind of lay back flatter. And if I have to lay on my side, lay on my side, but support this section of my neck with either a rolled up towel that you can stick in there to help keep the vertebrae straight.
Okay.
So the doc did say when they put the pin in the back that it's going to stay straight, but you still need that support in that area.
So let's talk a little bit. We didn't dive into this, so let's go backtrack here a little bit and talk about actually what is now in your neck. So you have 4 cages that separate your vertebrae. That's where your discs were, and they are called a cage. It's a metal device, and in that cage is some, I don't think we ever got the answer whether it was pig or cadaver material that helps the bone grow and fuse over time. Yes. You also have a plate that runs from 2 to 6 in your vertebrae for those discs that were removed, right? Yes. There's a long one plate, and then there are on each side, there are 10 screws on each side. No, there's 10 screws altogether on that plate. So you have 5 on each side, and then in the back, you also have spacers in the back of your neck, which actually help generate and fuse the space correctly. So that kind of leads us into what your lovely
gauge.
Yeah,
that's a gauge.
A gauge, right? It's separating.
Where they, with what had happened with me, the disc had smushed the vertebrae together, so you lose that space here. So the normal space is, I don't know what it is, but they end up
putting spacers
the vertebrae to put this cage in right here at the right distance,
right?
And then it forms everything on it. So
right. So you actually have screws in the front and you have spacers in the back.
Spacers between the vertebrae.
Okay. So
and then a rod in the back that's going down the back of the spine.
Okay.
As well, that's screwed. And
all right.
Along with the
plate in the front. Okay, so that kind of leads us to your necklace. One of the things that's really important in this recovery is getting your vertebrae and your bones to fuse. That's why it's called a fusion. So over time, about a year, we've been told it takes for your body to generate and reform the connections between your vertebrae using these cages. So the black device that you're wearing around your neck, that is a bone stimulator that helps your body stimulate the growth of that and the fusion of your bones back where you had before surgery, but now your body has to reform all of that. Talk to me a little bit about that. Is it comfortable? Is it uncomfortable? And how long do you wear it every day?
It is. It's not really uncomfortable, except when you lay flat. All this stuff wants to come up. So that's why the chair is important. It helps you sit straight, lets you sit this on. What I have found that I have I don't know which one it's called. It's a weather jacket. It's got a hoodie on it. I have found that by wearing this and then putting this on, it helps cushion this on my shoulder.
On your traps, which is where you've had the majority of your pain.
And by wearing this, I think I was just putting it on with a t-shirt originally, and the traps this sits right on the traps where they cut, and I think it was irritating it. So by putting this mock or this weather coat on, flannel, it's helped cushion that, and it's helping be able to wear it, because I have to wear it for 4 hours a day.
Right, so 4 hours a day, but you can break that up, right? You can do an hour here and an hour there, or 2 hours here or 2 hours there.
2 hours in the morning, 2 hours in the afternoon.
Okay, and it cuts off after you reach that fourth, and once you've completed that requirement daily, correct? Okay.
Yeah, you just push a button when you want to take it off after the 2 hours. Then when you stick it back on, you push the button again, and it just takes off again.
One thing I want to talk to the audience about this is not a new device, but it's newer in terms of medical history and medical devices, and it has given patients like you a really good result in that their bones are stimulated and the bone growth has been accelerated by wearing this. The one thing I want the audience to know is this is not a covered device by your insurance. Your insurance is not going to cover this. It's expensive. It was $3,600. That's a big piece to pay, but the company that we got it from will work with you, and you are given allowances based upon your income and how many people are in the house, and so you don't have to pay, or you shouldn't have to pay that full price for it. Just know, if you're watching and you are told that you should get one of these, you definitely need to work with the representative and let them know that you're gonna need help with the payment, so you don't have to pay all of that out of your pocket, because like everything else in our medical field today, you're going to have deductibles and all of that, and this is another piece of that puzzle that you just want to make sure that you get as much help as you can to offset those expenses. So I guess a really big question then, Bill, would you make the same decision again, and would you have this surgery knowing where you are today physically versus where you were before surgery, and have all the frustration been worth the effort?
At this stage of the game, and knowing what it was happening to me back in the earlier days, when I was dragging my foot, I was falling a lot. And when I fell, I really would fall hard and my bones would crack. I thought I was breaking things. I would say yes, I would have the surgery done again. I anticipate on at least probably a 90% recovery. I don't think I'll get back to 100%, but I'll take 90 all day long.
Awesome. Well, guys, that's it for today. We will continue to do videos again and give you some additional progress, maybe at the end of January. We hope this information is helpful. And of course, if you have questions or concerns, please reach out to us, send us a message, and Bill will definitely get back to you and answer those messages, or I will for him. And we appreciate your time today. God bless.